right, so before everything else, let me introduce myself. So my name is Kyla, and I am in Uni Global's content specialist. Co-moderating today's session, I am also joined by Navneet Kaur de Leon, Associate Director of InUni based in India. She also manages all US institutions under the InUni portfolio. So her role primarily involves working closely with the university partners and supporting student recruitment and strengthening collaborations across the region. So you will be hearing more of her today as we move forward. So, in today's session, we'll take an inside look at the MBA in Healthcare Management, covering the program's coursework, career opportunities, and the real world impact graduates can make in the healthcare industry. We'll also conclude with a live Q&A session to answer your questions. So feel free to drop your questions in the Q&A box just down below your screen. If you see the three dots in the middle of your screen, just down below, you can see the Q&A, and you can just click that, and then you can send in your questions right after. All right, just a few housekeeping notes for everyone. We highly encourage you to ask questions throughout the webinar. So please make use and utilize the Q&A box again. So our speakers will do their best to address your questions as we progress through the key topics and discussions. Okay, moving forward. So I'm very delighted to have two outstanding speakers with us today, each bringing unique insights and real world experience to the conversation. So join me in welcoming Dr. Karen Calendo, Associate Professor of Healthcare Management and Discipline Chair of Management at CUC. So, drawing on extensive experience in public health administration, leadership, and entrepreneurship, Dr. Calendo is a passionate educator and author dedicated to preparing students for success in today's evolving healthcare and business environments. So, how are you today, Dr. Karen? I hope you're having a good day.
Yes, I'm very happy to be here. Excited.
Thank you very much for joining us. We also have Dr. Michael Carroll, Associate Professor of Business and Chair at CUC. Dr. Carroll brings extensive leadership experience in higher education, having served as a dean, university president, and a faculty leader across several institutions. His expertise spans business education, financial statement analysis, critical and creative thinking, and effective learning strategies. He also has been a keynote speaker at international conferences on strategic management and innovation. It's great to have you here today. Dr. Michael, how are you doing?
I'm doing great, and I'm very glad to be with everyone this morning.
Thank you so
Thank you.
much. So it's great to have you both today. Thank you all again for joining us. So to start things off, let me call on Dr. Karen to give us, value to the MBA. What's it all about?
Okay. I'm starting off. First of all, I want to thank you for being here today. I know everybody has a really busy schedule, so I appreciate your time and coming. We want to start off with our business administration, which is a phenomenal foundation for the healthcare administration specialty. We have Dr. Carroll that's here going to talk about it. He has put much effort and research in compiling and creating an outstanding program. And he will talk to us about it today. But I wanted you to know we're starting with this piece, which makes it very unique in regards to it gives us your students that you'll be recruiting a competitive advantage of having competency in business and then be able to go beyond that into the healthcare specialty. So the two combined are just outstanding for allowing students to have the competency and the confidence to move forward in healthcare administration. So Dr. Carroll, if you want to go forth and explain the business administration program, the MBA.
Yeah, yes, I would be delighted. It's near and dear to my heart. As the host introduced me, I've been at a lot of different universities. I've served different roles. I've been a dean 3 times as a president of a university. I've been many places, and it's been a great journey. And when I got hired by Concordia several years ago, not that long ago, one of the first assignments that I had that I was given is one of the most rewarding that I've ever had in my academic career. They asked me to redesign the MBA program. Quite frankly, it needed updating and it needed currency to take a look at really what are the competencies and skills that a graduating MBA student should have. So I embarked on this task, and I looked at MBA programs all over the world. It was about a 6 month research that I went through to not just U.S. MBAs, but MBA programs all over the world, but also that had changed within the last 3 years, that had been updated or modified. So I was able to get a really good pulse on what the future or evolving MBA program would look like. So, before I get into some of the specifics, yeah, I guess I'm a little biased, but it's really a cutting edge, relevant, um, current, and even forward looking set of courses and competencies that you will get if, and hopefully when you join our MBA program. Uh, so what I found in these really innovative, progressive MBA programs, I started to find clusters of courses, clusters of competencies that it didn't take too long to see a pattern developing. So our core MBA, you can get an MBA without a concentration. That's 30 credit hours. Our webinar today is about the MBA, in healthcare. So you would take the MBA core that I'm going to talk about, and then you would take the healthcare specialization courses that Dr. Calendo is going to talk about. But some of the unique qualities of the core MBA program, I divided it up into three sections. And the first section, as you can see on the screen, I call it, the foundation skills. No matter what MBA program, that I was looking at from the US or, international, there still is a basic or required core competencies that a graduate business student needs. And those core competencies and probably sound familiar to you. A core course in marketing, in accounting, in finance, in economics. I added business analytics. Courses used to be like statistics or quantitative methods, but business analytics is at the forefront of quantitative component of business. So the first section is a collection of 4 or 5 classes, depending on if you have a concentration or not. The second category, which I think is really unique and would be extremely valuable for you, is the thinking section. It's comprised of 2 thinking courses, but they're almost like diametrically opposed. You can see, on the screen, one of the courses, it had to be there absolutely had to be applied artificial intelligence. There absolutely had to be a course on that. And by the way, we're incorporating artificial intelligence in a lot of other of our courses and in the specialization courses, but we needed a foundation course to really give the overview and give students a real strong foundation in how artificial intelligence works. So it's the background of artificial intelligence, but also it's applied. What are the tools and how is it being used in business? That's one of the classes. Another class that I saw in the really innovative and progressive MBA programs is a course called Design Thinking, and I actually created it and I teach it. And design thinking is the opposite of artificial intelligence. Design thinking is a humanistic, empathetic approach to solving human problems in business. It's a really a refreshing and it's a needed course because one of the worries or criticisms about artificial intelligence is that it's heartless or it's soulless and it just
Mhm.
it makes the most efficient effective decisions. Design thinking is the opposite of artificial intelligence. So it's a really good comparison and contrast into the importance of both of them. So design thinking is going to be one of the more interesting and eye-opening courses, and it's just as impacting and significant and as important as artificial intelligence. It just doesn't get the headlines. There are so many corporations, successful ones, that have really adopted and incorporated a design thinking philosophy and approach. In addition to using, artificial intelligence or, business analytics. So it's a wonderful set of two courses. I wish I could, I wish I could have done three courses on each one of them, but you know, we have to kind of keep an eye on the amount of courses that you can afford and take. And then the last section is um, kind of the destination. It's kind of like the finish line. If you come to Concordia, one of our foundational principles is ethics. Is ethical, moral leadership, uh, and it's pervasive in all of our courses. But in the MBA core is a class on ethical leadership. So we're not just interested in helping you make good business decisions, but we want you to be able to understand different ethical frameworks and make decisions that are going to make the world better, not just your business more successful. And then the last class is typical of a lot of MBA programs. It's the capstone that it's a strategic class that tries to incorporate all the different competencies and insights and skills that you have learned in the previous courses and make sense of it and synthesize it and do something hopefully extraordinary with them. So that's the core that everyone's going to take. And then we have a number of specializations that you can additionally take, and that's what kind of is the focus of today's webinar is the healthcare management specialization. But Dr. Calendo wanted me to give you some background and understanding of the significance and what's gone into the core to prepare you to then further your development and your skills in healthcare management. So we're very proud of our MBA program. And as the
Okay.
host said earlier, if you have questions, yes, just we try to make this informal, so feel free to ask us as we go along. So with that, I'll turn it back over to you, Karen. Hopefully that was given the students a background of what to expect in our MBA program.
Thank you, Dr. Carroll. Yeah, no, it was really good. It was a nice overview. And what I plan to do is I want you to understand the MBA and the foundation and the competency. When you're getting an MBA with a healthcare management, what's really great about it is that you have those foundational business skills and the thinking aspect. When you're in management, there's problem solving every single day. And so you got to learn, it's important to learn the thinking models. Even though we have AI, just as Dr. Carroll said, you want both. You want to be able to, especially in healthcare, when we're talking about healthcare, it's really important to have that human element, which we'll talk about in this. Okay, our healthcare management is a specialization. It's 4 extra classes. And how you can look at it with the MBA, you get the business foundation, which is essential in healthcare management. But then with the healthcare management courses, you're going to learn how to apply them. And then you're also going to learn things that are vital in the healthcare management world. Next slide. Okay, it is a growing field, okay? Even though AI is here, as we've been saying, the human element is so important, okay? We're looking at more than 2 million new healthcare and social service jobs in 2031. And some people might be intimidated, like, well, what about AI? What the buzz right now? What jobs is AI going to take? Well, they're not taking healthcare administration. As we highlighted, it's a tool that healthcare administrators use and we teach in our course, but it is definitely a growing field. And it is a rapidly changing field as well. Next slide. Okay, the need for leaders. There is a growing need for leaders with competency, and you're going to hear that word a lot in this webinar. The reason is the more competent a leader is, the more effective the organization, the better outcomes we have for patients, the better finances we have for the organization. It's just a well-organized, well-run healthcare organization, and it all starts with the leaders. So with this program, you're going to learn about the ethical leadership, which is very significant in healthcare. Healthcare has so many ethical issues. And so that's a really important, and that's one of the reasons I think Concordia, which the next slide will talk about, why it's important to come to Concordia when it comes to healthcare leaders. Some of the changes that are going on, of course, some of the things in modern healthcare is all about quality and efficiency. We have a course that teaches on that. You learn about, and I'll talk about it later, but it talks about putting quality improvement plans in, which is really significant because it will help you with your costs. It'll help you with operations. It'll help you with patient care. And then also the technology is a vital part of healthcare administration. We also have a course that focuses on technology and learning which kind of, how to put a technology plan together and to look at what technology you want for your organization and how to make the right decisions for that. And of course, we got to learn about the governance inside and outside of healthcare in the United States. Unfortunately, the healthcare system is driven by the government, a lot of regulations and rules. And depending who's in power, Republican, Democrat, typically, it's an ever-changing process. So it's really good to understand that what's going on in that realm. And of course, it's a growing field. Yes, Navita, you have a question?
Yeah, I have a question, Dr. Carol. Thank you, Dr. Carol, for giving an extensive idea about the program MBA, how it is built. But then I have a question, which of course, the students might also have, that can MBA healthcare management be taken by students with, who do not have the healthcare background? So is it open for all the kind of students or without, healthcare background as well?
Yeah, that's a great question. Usually have two types of students, okay? You have those that want to get into healthcare administration, which there's lots of opportunities, even if you don't have the experience, even though we recommend if you can volunteer or start getting into it. But yeah, you have the financial aspects, the operations, there are different types of areas. It's a huge industry where there's just so many opportunities when it comes to healthcare management, even outside of the clinical. You have businesses that deal with healthcare. So there's a lot of different opportunities for those that will just want to get in the field, but absolutely have no experience. On the other hand, what you could have is you have clinical people. They've been working as a nurse, they've been working as an x-ray technician, they've been working as a clinician in healthcare one way or another, and they want to get into the management part. Or often what happens is they're promoted. Often in the clinical realm of healthcare, and people are promoted within, but then they're in this position that they're not skilled for the business aspects. And that's why the MBA aspect and in the courses we offer in the specialty prepare the clinical people as well, because even though they're in the healthcare, they don't know the business aspects of things.
Right, right. Thank you. Thank you for the clarity, Dr. Karen. Yeah.
Sure. Okay, next slide. Okay, I'm going to review some of the courses so you get a flavor of the courses. I do want to talk about, though, before I start there, because when you're looking at programs, you want to make sure they're solid programs. And Dr. Carroll gave a good foundation of our MBA, and I'm about to talk about the management specialty. But also, I want to talk about Concordia itself. Concordia, I think when you're looking at organizations, you want to look at the culture of the organization or the culture that you're walking into. Going to a large university is much different than going to a small university. And the reason I want to highlight it, especially for international students, is because sometimes it's not your first language or whatever. We have a lot of support systems here. Okay, we have a Center for Excellence that will help with writing and will help with tutoring and helping with math if math's not your thing and you get sort of intimidated by that. And I can honestly say that we're very supportive. All our faculty, the process to get hired is very stringent. And part of it, they're looking for people that fit the mission. And part of the mission is truth and also the compassion that comes with being a Lutheran university. So we look to have success with our students. So we have the academic piece, but we also have the culture that supports it. So going on to the courses, when we have the healthcare systems one, or just healthcare systems, it talks about what you're going to learn, what the students will learn is how to put a healthcare system plan in place. And throughout the course, you're going to learn on the importance of the healthcare systems. It's going to look at how to assess them, how to identify what your organization needs, and then also how to evaluate and then implement. And this is really important because in healthcare in the United States, you have certain systems that dominate the healthcare. For example, we'll look at Epic. Epic is like in 90% of the top tier hospitals in the United States. And why it's important to learn this stuff, that's where the AI component comes into a lot of the healthcare administration roles. So you're going to have the opportunity to learn how it goes into the system. So it has tools within it. So you don't have to go outside of it. So you're going to learn the process, what to look for, so you could run effective organization, whatever role you're at and at whatever level you're at. Because depending on your level depends on the amount of AI or what type of AI you need. And then also back to what Dr. Carroll said, not only do you have the AI component and you have the strategy component, you have the human element of making good choices with the compassion that is needed to serve patients, and also picking choices that support your healthcare professionals. And then the next one would be if you could go back, I meant there's two on the slide. The healthcare systems 2 is more about quality. You're going to learn about quality programs, okay? How to put an improvement process together. We work with Six Sigma. You learn about lean and what that means you learn how to evaluate your programs so that you have quality, effective programs. You're looking at operations, you're looking at the impact that it'll have on the whole system or just your department. Again, the skills you can learn are going to work at the different levels depending where you are in the management tier. So when you look at that, you'll learn how to evaluate things, and you will know how, with the things taught in this class, how to bring actual improvement, okay, to be able to evaluate it, what you need to change, and then go back and make sure it's working, and also how to train the staff so they're able to implement it. And that's a huge component of it. So you're going to learn that process, which could be used, again, like in any department in different ways. For example, it's one that you could use, let's say in emergency rooms. Let's say your wait times are very, very high. You would use this process that you're going to learn to be able to bring down the wait times, which impacts your reputation, impacts patient care, impacts accreditations, certifications, all kinds of things. So this is an important skill to walk away with. Okay, the next one. Okay, innovative. Our MBA 6670 is our innovative one course, and that's more of case studies. You're going to learn about different businesses, different organizations, how they work, and how to look at different innovative processes and learn best practices in the healthcare realm. We also will do a comparison of the innovation in other countries as well, just the whole United States system. For example, they're looking at having one system. Epic is the volunteer and the leader in this, so that one healthcare technology is run throughout all of the major hospitals and healthcare systems in the United States. That's in process, so you'll learn about that. So that's just one example of innovation that's going on, which there's many obstacles to make sure everybody's on the same programs, and being aware that also understanding how it could work with your regulations and also all the different laws. Okay, and then the MBA-H is 6675. This is the analytics one, and this is really very exciting, which is not always in a program. You're going to sort of get it twice. Dr. Carroll talked about the analytics and the thinking, and this takes it to a whole different level, applying it. This is more of learning what to do with the data. You're going to learn how to get the data, what to do with the data in many different aspects of healthcare. For example, you could look at your billing, okay, and you would be able to identify maybe some billing issues or expenditure issues, and be able to look at that data and figure out what you could do with it to make changes. Also, you could do it for improvements like we talked about for the other class, as far as wait times, looking at different data that impacts your reputation, operations, cost, patient care, patient outcomes, looking at different things that could impact your regulations and accreditations, like safety issues. So combining all of these courses, you'll have different types of delivery. You'll have case management, you'll have course projects, you'll work with real businesses, and you'll have a comprehensive approach. And one of the best things is you actually will have the skills to make an impact in your organizations, using the data, looking at innovation, even learning things. Sometimes people are even in a healthcare and they aren't aware of what's out there with the innovation. So that will be important aspects. For example, like the wearables. Some people in class aren't aware of different things that are going on in healthcare that saves money, like patients that could wear things at home to check their heart with cardio patients. And they don't have to come in, and they're able to check things, and it's better care for the patients. So it's all about competency, effectiveness, and really the patient. When we talk about all this, it's all for having good patient care. When you're in the management roles, you have to be aware of the risk factors for your organization. You got to look at the costs. You got to look at the operations. You got to look at the healthcare providers that are providing it. And of course, you got to look at the patients and the outcomes for the patients. With that, they also learn at different models for providing good care to the patients. Okay, next slide. Okay, like I was saying, the programs at Concordia, they're very, you teach about ethical leadership, which is significant in the field of healthcare. You need ethical leaders so they make the decision, because in your mind, when you're making decisions, you're thinking of the cost. You're thinking of the liability for your organization. You're thinking of your healthcare providers that have to implement the policies and procedures you put in place. And then the most important of all is the quality of care that your patients will get. And good efficiency really matters. Example of this is at Rush. If you go, let's say, to Rush Hospital in Chicago, if you go to their orthopedics, when you go there, orthopedics, the wait is like just a few minutes. Okay. Then you go right into x-rays, which is just a few minutes. Then you go completely right to the doctors, and it's just a few minutes there. Okay. And then you walk out with a diagnosis and walk out with actually some things some equipment you might need. And the point of that story is when you do a program like this, you'll be able to build high quality programs that could bring in efficiency that benefit both the organization and the patient. Because the more barriers you have for patients, the less decrease in good outcomes. And then also I want to talk about, we had a graduate at our 2026 spring commencement, and she was from this program. And it was very exciting to hear her story, to hear how she loved the program. And also that she would be able to, her goal was to actually start a hospital. And she felt very confident in being able to do that once she completed this program. Let's see what else we got. Okay, career focus. No, that's okay. Next slide. Career focus. Okay, the skills you'll gain. You'll get the skills to deal with complexity of the healthcare system, which is very complex. When you look at all the different insurances, we'll address that as well, and how things are paid for, how things are delivered. It's just a very complex system here. And to also get the background you need to understand, like the HR elements was really important for liability, to reduce litigation, and to hire the right people and know how to do that. The finances, if you can't run your finances, the facility's not staying open. And then, of course, all the information system example that I gave, like Epic, and learning which one. They have different things that you could choose from, and the most important is the patient care. You're going to use these strategies. We definitely incorporate AI. And with that is, I love how Dr. Carroll shared how important it is to have that human element. And of course, the regulations. That's such an important thing. You have a question, Navita? Am I saying it correctly? I'm sorry.
That's fine. It's a tongue twister. My name is a tongue twister, anyways. So it's Navneet. So one of the questions which a student has asked is, aside from the hospitals, what industries, MBA healthcare graduates get in, kind of settle into? So do you have any examples to give to the students?
Oh, definitely. So you have hospitals, you have clinics, okay, you have care organizations, like the American Medical Association. I mean, there's just so many medical associations. And then also because it's an MBA, you could also go the business route. Like you could work for pharmaceutical companies, you could work for insurance companies, you could work with anything that pertains to like medical equipment, anything in the healthcare field, in insurance, Medicaid, Medicare, government. There's so many different opportunities to get into that's not necessarily the clinical aspect of things, or hospitals or clinics. Also, there's public health. That's my background. I absolutely loved it. And the public health. And what's nice is exactly that. Like if you're in one field and then you want to stretch into another, you're not starting a whole new career. You're just growing your resume. And so there's definitely so many avenues that you could use this degree. And that's why I like the MBA with the healthcare specialty, opposed to just like a public health degree. This is why it's good. It makes you more marketable as far as all the diverse careers that are out there, and teaching too. You can teach for healthcare administration.
Right.
Okay.
Thank you. Thank you for the clarity. I have another question, which is again asked by a student, which probably can, both of you, it's kind of for both of you, Dr. Michael and Karen. So, Dr. Karen, so it says that, okay, what is the length of the program? So maybe MBA and MBA healthcare management, if we have, different lengths of the program. So till when they can, I mean, how long is the program is for?
So if a student takes a specialization,
Mhm.
the core is not 10 classes, it's 9 classes. We drop, there's an option where, we drop a class. So it would be the 9 classes, and some of our specializations are 4 classes, some are 3. So in this case, healthcare administration is 4 classes. So it would be 9 of the core instead of 10, and then 4 of the healthcare courses. So that would be 13 courses
13.
or 39 credit hours.
Right. Thank you for the clarity. Yeah.
Okay. This was going to be.
Okay, right. So I can talk about the entry requirements. So a lot of students, would want to know that what is the English requirement if they are applying for, MBA and MBA healthcare management. So these are the typical scores which the university looks at. We need a TOEFL of 72 minimum. So that's an overall score we're going to look at. An IELTS of 6 overall. The individual requirements are not really very, very specific here. So we will be looking at an overall score of 6 in IELTS. And Duolingo, we accept Duolingo as well. And we accept PT as well, with the minimum score of Duolingo being 95 for the MBA and MBA Healthcare Management, and PTE being 61. There are some countries which can get an exemption for the English proficiency test, which are mentioned on the right hand side of the slide. So any student would want to click a, picture of this particular slide for their clarity. They can, refer to it later. Coming on to the tuition fee, Dr. Carroll just said that MBA is a 30 credit program. However, MBA Healthcare Management is going to be a 36 credit program. So typically, the estimated tuition cost is going to be somewhere around $25,000, 596, and it's going to be offered on campus. So it's going to be a full-time in-person education. And for the admission documents for students who want to apply, they can submit their undergraduate transcripts, which should be along with their bachelor degree. It could be a provisional degree if they haven't received their degree documents yet. It could be a provisional degree or their, degree document. Along with that, we would need a passport. Apart from this, if anyone who's going for a transfer application, which means that they are transferring from a US school to Concordia University Chicago, then we would need official transcripts from the US school along with the other documents, the set of documents. And we are going to look at a financial requirement of approximately $40,000 nearly, which will cover your first year tuition and your living expense. So that's basically, your I-20 amount, which you have to showcase to your I-20. So anyone has got any questions around this, they can just put it in the chat box. I'll be happy to take these questions. Maybe we can, I think we're done, and then we can questions I have, which, are there in the chat box, and I can take that up. Just a moment. Okay, so it's a very interesting question from a student, that they would love to know the current challenges in healthcare industry. That what are we facing right now?
Oh, wait one second. The challenges that we're facing right now is the ethics with AI. And here would be example, if a doctor uses AI and gets a diagnosis or treatment from it, and things go wrong, who's liable? You know what I mean? If
Yeah.
it opens a can of worms of liability when you're talking about AI. Also, you have the risk of people maybe not using the human element and really thinking through things. Okay, that's it. Also, the cost. The cost of healthcare is tremendous. Even the insurance is tremendous. And a major also one is medication. And how that impacts administrators and healthcare professionals is they have to be aware of that when making treatment plans, whether the patient could actually afford the treatment. And it's a lot of ethical stuff, because if they can't afford the treatment, then you have to come up with something else they could afford. So affordability is huge. Or do people even have the money for the treatment? Another is accessibility. Different facilities are closing throughout the United States in different demographics, different zip codes. So that's an issue. And then
Right.
I think a constant issue is always the political aspect of health and in healthcare in the United States, because it determines how all the regulations and the laws, and for example, HIPAA. Okay. And then HIPAA could be an issue too with AI, but I would say the political climax, and then also we have a shortage of nurses, that are a shortage of healthcare workers, which falls on the burden of the administrators. How are they going to navigate that? Though I do have to say AI is really helping healthcare administrations with those type of things, because it's giving them more, it's giving healthcare professionals more freedom. For example, it'll record their notes, and that was always very burdensome for healthcare professionals. But I would say the cost, the shortage of workers, and the political climax, and then how we're going to navigate AI.
Right. Right. There's another question by a student who's asking, does the program help students secure internships?
Mick, do you know that answer?
Yes, we strongly encourage. We have a department at Concordia that works strictly with obtaining internships. The faculty members work with the students as well as graduate advisors. So yes, we do work closely with many different channels to give students an internship opportunity. Strongly encourage it.
Also, I want to highlight that Concordia has been around since 1862. And with that, we're right outside of Chicago. We're right there. It really lends itself to a lot of, we've had a lot of partnerships for a very long time, and with the VA and different local hospitals and stuff. So yeah, it's a great location as far as internships.
Right, right. So there's another question which I can take up. So which says that, is credential evaluation report required for the admissions? Yes, it is going to be required. So you need to get your credentials evaluation done for the for the GPA evaluation, and accordingly the acceptance or the decision is going to be made on the application. Okay. So there's another question. Do you get many international students for MBA healthcare?
Yes. Matter of fact, the student that I was talking about that did the speech for the commencement, yeah, we get a lot for the MBA, and people that will transfer to the, will go on and get the healthcare administration.
Okay, right. And I have another question, from my own, for my own knowledge. That Are there any practical projects or case studies the student, has to do within the curriculum, so that they get, some kind of industry related assignments which are relevant to their jobs, and then that helps them, take over once they get into the job market?
Yes. Off the cuff, one of them I'm thinking about is with that quality improvement. They literally will have a project that they have, that they need to identify a problem with a local organization or organization, picket organization. They find an issue, and then they put together the approving process for quality improvement process for that organization. So that's definitely something they could put on their resume, and also just that opportunity to actually work with a real company.
Okay. Right. So Dr. Karen and Dr. Michael, what would you advise to the students who want to build, a long-term career in healthcare management after graduation? So what all they should be preparing for, and what are they looking at when it comes to, after graduating from the program, including the preparedness, and then what they have to be prepared with, and then what all they have to cover within their education duration, apart from the curriculum they are studying?
Well, Karen touched on it quite a bit, but I'll reemphasize that uh, it's our firm belief that artificial intelligence is not going to replace, human ethical decision making. However, the more students are adept and can utilize and apply artificial intelligence, they're going to be viewed much more favorably than students who don't have any experience with artificial intelligence. So, one of the things that they can do is, take it, look for different certifications. There's all kinds of avenues to, outside of Concordia to get more proficient in the application of artificial intelligence. That's true of any of the disciplines, any of the business disciplines. All the literature that I have seen is employers are looking for graduates who have experience using and applying artificial intelligence.
Mhm.
That would be a really big one.
Right, right. Right.
Yeah.
I have another question in the chat box, which is the last question. What is the can a business student apply for this program? Yes, absolutely. Like Dr.
Absolutely.
Karen just
We want you.
mentioned. Uh, yeah, yeah, yeah. So, how much is the tuition? So the tuition, Vijay, if you can take us to the slide again, so that the students can take a picture of the slide, but then it is approximately, just to give you an idea, the approximate tuition here it is. Um, it's going to be around $26,000. Yeah, so 25,596 is the estimated entire program cost. Um, there is a deposit fee. Yes, the deposit fee is going to be $6,000 once you have gotten, admit. Uh, what are the entry requirements? The entry requirements are very simple, that we would need your transcripts of your bachelor degree, and then along with that, we would need a bachelor degree. If you are transferring from a US school, then US official school transcripts, your passport, your English proficiency test, based on which country you're applying from, and your financials. So these are the basic requirements to apply. The course duration is going to be for MBA healthcare, it's going to be 36 credits. So we are looking at typically 4 semesters, to complete the 36 credits, if I'm not wrong, Dr. Karen. Or maybe the student can
Mhm.
complete it in 3 semesters as well.
Yeah, 36 credit hours, and then they're 8-week courses. Yeah.
Yeah, right. I think, yeah. So, thank you for asking such great questions, and thank you to the audience for being so, interactive.
Well, thank you
Over
very
to you,
much.
Kyla.
Thank you very much, Navneet. Navneet. So before the session ends, just one last question for you, Dr. Karen and Dr. Krell. If you could just give, just one piece of advice or a tip for international students who are watching right now, hoping to build a successful career in the US healthcare industry, what would it be?
I think understanding what, looking at a strong curriculum, okay, and then finding a university or school that aligns with your values, aligns with, and I think for international students, I think smaller schools are really good because I think they're much more supportive. So that's something to consider. I've worked at large state universities, University of Wisconsin, Milwaukee, R1 school, and it's a wonderful school. It was great. But I think when you're an international student, you have a lot more challenges than an American student going to American university. And so I think the whatever university you choose, the more one that could provide you the most support, I think would, because you want to set yourself up for success. So look at not just the curriculum, but the culture and something that supports your values and that you would feel supported. I think it's really important.
And I would add to that, what's critical is networking. Don't come to Concordia and just take your classes and stay in a real closed knit environment. Um, you know, participate in local organizations, volunteer at hospitals, you know, maybe get an internship at a hospital, but you got to network. Don't be shy. Get yourself out, and we'll help you. But
Mm-hmm.
we want you to develop relationships where you're not going to start from scratch looking for a job once you get your degree. It should be, part of the process as you're working on your degree.
Yeah.
Wonderful. Thank you so much. Would you like to add to that, Dr.
I
Karen?
just want to say, we are by a major city. Chicago is a major city. Okay. But when you walk on campus at Concordia, it's and online, it's very warm. I mean, that's the thing. Even faculty that are new here will say, and I think that kind of stuff, that you feel welcomed, you feel valued, is just as important as the curriculum. So just saying, even though we have great curriculum.
Thank you so much, Dr. Karen. I totally agree with you. So CUC has been there for their students, even the graduates that already went to their, specific career paths. CUC has always been there for them and has been supporting even our international students. So yeah, we do hope that, you found these advice very helpful. And this is a perfect takeaway for, our audience for today to keep in mind as we end today's session. All right, so we've uncovered and covered a lot of, great questions. And thank you so much, everyone, for your active participation. Again, a big thank you to our incredible panel for today, Dr. Carolyn, Dr. Karen, and also Navneet. Thank you so much for today's discussion. So if you're interested in learning more about CUC or have additional questions, we do invite you to visit CUC International social media pages dedicated especially for international students like you. So you're also welcome to send us a message anytime. So our team will be happy to guide and support you throughout your application journey. Once again, we do hope you learned a lot, walking away with valuable insights, and we look forward to seeing you on our next webinar. So until then, have a great week. Take care and goodbye, everyone.
But
Bye.
and good luck, everyone.
Yeah.
Bye-bye.
Good luck.